Lawmakers now gather in Montgomery this session. Part of their job is to approve next year's general fund budget. It's something that we're still a few weeks away from learning.
Part of the general fund goes to Alabama Medicaid. Wait 31 reporter Paige Meyer spent the day taking a deeper dive into how our state's reimbursement rates are set.
A spokesperson from the American Academy of Pediatric Dentistry tells me the amount of money that a physician is reimbursed and the procedures that they could get reimbursed for is all determined by the state. So what lawmakers decide in Montgomery over the coming weeks could in turn impact all of us. Now, Dr. Casamassimo explained while each state is a little different, it's ultimately a legislative decision to determine what the state is willing to put into Medicaid. The state Medicaid agency then determines where the funds get distributed. He says Medicaid reimbursement rates impact everyone, not just Medicaid patients and the doctor's offices who accept them. If a state's reimbursement rate is not adequate to meet the costs of a doctor, it can then have a trickle-down effect impacting its staff and patients. It's possible those impacts could put some doctors in difficult situations when it comes to serving their communities.
Medicaid has covered the cost of delivery of care, and that's why the number of dentists who will see Medicaid is so low. Is that they actually lose money by caring for Medicaid covered patients.
Dr. Casamassimo says if Medicaid reimbursement rates were equivalent to commercially covered patients, it would help solve staffing issues. Now, if the state paid doctors' offices, which help Medicaid patients, for more services, the offices would in turn be paying in more revenue to pay its employees. Now, coming up on Wait 31 News at 6, we'll discuss how other states have reacted to higher rates. But for now, reporting live with coverage you can count on. Paige Meyer, Wait 31 News.